I'm Dr. Don, and it's good to talk to everybody. I've been doing this for about 30 years, and it is such gratifying work. I really enjoy what I do. When I come home at night, I'm still energized from the day at the office. It's just to be able to help people and make meaningful changes in their lives. It's great, and I get a lot out of it too. I think the interaction between two people uh, is so meaningful. That connection, that attachment uh, that we have is an attachment is one of the biggest pluses. I think it's essential for any type of therapeutic relationship. For the person to feel comfortable with the person they're working with, have a sense of them as a human being, as somebody they really can interact with, understands them and knows them in a very powerful way. And I get a sense of that person. I can feel the essence of where they're coming from, what their heart is telling me, what their soul is saying to me. And that is of utmost importance. The other big element that I think is so essential is um, helping people connect to emotions and their feelings. As children, we come into the world and we have different defenses that we set up to survive, to protect us. And we carry these through into adulthood. Unfortunately, these defenses don't, although they were essential for survival, don't help us as adults. And breaking through those defenses is an important tool to help the person realize the blocks that they're putting up and to get past them to the emotion and to connect in a more loving way with themselves so they can be more loving toward others. And I found that to be so fascinating in the work. So those are two pillars of what I do is the attachment, the connection, and also helping people connect to their feelings. Now, having done this for over 30 years, I've developed an ability to work with children, adolescents, and adults to do this. I previously had worked in the school system for many years as a school psychologist and for school mental health, and had exposure to many young people who had all kinds of difficulties. And I worked in various areas of the city of Los Angeles, the inner city, um, you Woodland Hills. So I've experienced tremendous uh, diversity in the type of young people that I've worked with, and work with parents and the issues that they bring. And one of the things I do is I'm like a point guard. Uh, I've got the ball and I'm passing off the ball to that forward, and helping coordinate and organize the treatment. So many times people come in and they just don't have a sense of uh, where to go and what to do. And for example, like if I'm treating an ADHD child, uh, I might do the assessment, but then the parents need some work, a behavior modification system. The school needs to be involved in the behavioral program. Educational therapy might be necessary. A psychiatrist might be necessary. So pulling everything together, and that's what I like to do with the treatment. Or if it's an adolescent, getting the parents involved. It's not just the adolescent's problem, it's a family issue. Many times the parents need some work. They might be suffering from anxiety and or depression. And of course, just working with adults who come in uh, with various trauma and anxiety and PTSD. And this has been an area that I've been able to work successfully with. Working with men, I've been involved with men's groups over the years and feel real comfortable with that. Some of the various types of trainings that I've been involved with, I have expertise in uh, emotion-focused, dynamic emotion-focused therapy, intensive short-term dynamic psychotherapy, behavior modification, somatic experiencing, uh, EMDR, just a lot of different, and psychodynamic psychotherapy. I've had exposure and training in a lot of different areas that have really helped me to tailor and individualize a treatment to the person sitting before me or the family sitting before me. And so that ability to be with that person in the moment and bringing the tools and the skills that I have has been so essential for my success. Um, and so I look forward to speaking with you further. And if you have any questions or want to find out more, uh, the phone number is there. And I look forward to the journey together and where that may take us. And I'll talk to you soon. I'll talk to you soon. Thanks so much. Take care.